Hello, and welcome to Care Talk, where we are answering your questions about healthcare and health insurance in America, and also talking about broader issues in healthcare and what you can do about it. I am the executive director of Healthcare Voter, and I also have personal experiences with our healthcare system because I am a cancer survivor, and the care I got through the Affordable Care Act saved my life. So we don't have just one health insurance system in America. We have several, from Medicare for seniors and people with specific medical conditions, to Medicaid for low-income people, to the VA system, to the Affordable Care Act, to employer-provided care. There's multiple different ways you could be accessing the care you need. And of course, there are millions of Americans that don't have insurance at all. Many of those people are able to get low cost or free care through Medicaid or the Affordable Care Act, but also many Americans are not eligible for those things. Anyways, we will be taking your questions all throughout the show, and you can also leave questions that we will answer in future shows. So let's start with Diane from Just Care and Social Security Works. Can you tell us about the key deadlines for Medicare and what people should be doing right now during open enrollment?
Absolutely, yes. So people with Medicare have until December 7th. So that's another little bit more than a week to switch their Medicare plans. And it is really, really important that you take the time to at least look at your options. If you're in traditional Medicare, not a whole lot has changed. You're going to pay your Medicare Part B premium, and you're going to have your Medicare Part A, usually because you've paid in already to Social Security over the course of your working life, for your Medicare Part A premiums, which covers your hospital and your inpatient care. But so nothing else will really change if you're in traditional Medicare. But if you're in a Medicare Advantage plan, or you're thinking of joining a Medicare Advantage plan, you want to look at what your costs are going to be and who you can see, which providers, which hospitals you can see, to make sure that you're going to be able to get the care you need. It's pretty hard to know in advance because you don't know whether you're going to end up needing a lot of health care or a little. But I always say to people, you need to imagine that your health insurance is there for all of the circumstances that you least expect, because that's when health insurance most protects you. So if you're in Medicare Advantage, or you're thinking of enrolling in a Medicare Advantage plan, you want to see what your premiums, your monthly premiums on top of your Part B premiums, because you continue to pay those as well, are going to be, what your deductible is going to be, and your copays are going to be. Most important, you want to see what your total out-of-pocket limit is going to be for inpatient and outpatient hospital services. It usually is around $5,000 a year on average, but it can be well over $7,000 a year that you'll have to pay out of pocket if you need a lot of care. So you want to protect yourself and know sort of what the most you're going to have to pay for these services is. With traditional Medicare, there is no out-of-pocket cap, and that's not good news, but you can buy supplemental insurance to fill all the gaps so that you don't have to pay anything when you go to the doctor or the hospital. But you do need to pay typically around $2,500 or $3,000 a year for your supplemental coverage, which fills the coinsurance and deductible gaps in traditional Medicare. The final thing you need to look at is the drug coverage you're going to have. If you're in traditional Medicare, you have a sea of what are called Part D prescription drug plans that are available to you. And you can go online and go to the Part D plan finder and put in the drugs that you're taking and see what your out-of-pocket costs are going to be. If you're already in a Part D plan, you still should look at what your options are, because your costs could be going up next year, and there might be a better plan for you that will cost you less if your drugs don't change in the next year. If you're joining a Medicare Advantage plan or you're already in one, You also want to look at what the coverage that plan provides you with regard to prescription drugs, because there you're going to have additional out-of-pocket costs, and those can be really significant. So you can save a ton of money if you take the time to look at all your options. And if you want free help, there's a state health insurance assistance program in every state that is designed to provide you with free help looking at your options. And while they won't tell you which option to choose, they are impartial and they will help guide you. If you're going to an insurance agent or insurance broker for guidance, beware, because many of them have conflicts of interest and make more money if they steer you in a particular direction and are not necessarily serving your interests.
Thanks. And Zoid Finch from Health Sherpa, can you tell us about the key deadlines for the Affordable Care Act and what people should be doing now as well?
Yes, so we have a couple deadlines this year. So first is December 15th and is the deadline to apply to get coverage through the Affordable Care Act. That would start on January 1st. So if you currently have an ACA plan and have not yet renewed, we recommend that you go in, update your application, get your new eligibility results. So that's what tells you what kind of subsidy you're eligible for and if you're eligible for the cost sharing reduction on silver plans, and then go ahead and shop for plans. Even if you're happy with your current plan, it's always a good idea to go in and do this anyway. Your current plan could be ending. It is going to be changing at least somewhat. The plans always change year to year. Typically, the deductible and out-of-pocket maximum will change. And then the drug formulary could also be changing. So you'll want to go in and check and make sure that your prescriptions will still be covered and still be covered at the same level. If you are not currently insured or you're losing your insurance soon, then you should also go to the marketplace to find out what you're eligible for. We recommend doing this sooner rather than later. In years past, healthcare.gov's call center, as well as our call center at Health Sherpa, we've had hours-long waits on the 14th and the 15th. A lot of people using the websites, so the sites might have errors or go down. If you do wait until the 15th and then happen to hit errors while you're trying to get enrolled, there's often different avenues afterward to still get help and get your plan started on January 1st. And we'll have more information about that as we get closer to the deadline or after it. But you don't, as much as possible, you want to avoid ending up in that bucket. So we recommend doing it as soon as you can. And then the next deadline will be January 1st to get coverage that starts on February 1st. Or sorry, January 15th for February 1st coverage. And we still, even if you don't think you'll need health insurance in January, if you don't have anything, I recommend going in and shopping now. You never know if you're going to have some sort of emergency, and the last thing you want is to not be covered for the month of January.
Thanks. And I just wanted to echo what you said about checking your plans and making sure they cover what you think they cover. I lost access to some of my specialty doctors this year because they were not in network with any of the insurance plans through the Affordable Care Act. But that's changed in Colorado for next year. So there are several different options. But again, check and make sure that whatever you're signing up for allows you to see the doctors that you need. So our first question is from Richard Davidson, and he wants to know, if you have not contributed to Social Security, can you still be eligible for Medicare? Diane?
Yes, you can. That's the good news. The good news is that if you are 65 or older and you haven't contributed to Social Security, you have a right to Medicare, Part A and Part B, and Part C. Part A and B being for traditional Medicare only. And then if you have a Part C, that's for the Medicare Advantage plan. And you will pay the same Medicare Part B premium that everybody else pays based on your income. The standard premium is $170.10 a month starting in 2022. But you will also have to pay a Medicare Part A premium, and that is steep. It's $499 a month. So that's almost $6,000 a year for Part A of Medicare, which you'll need to cover all your inpatient services, your hospital care, your nursing home care, rehab care, is all covered under Part A. So there's a price to pay, but you can get Medicare, and it's actually a pretty fair price relative to what you would have to pay in the individual market for insurance at the age of 65.
Great. And this next question is from Anne Malizia. I want to know why the plans have such a huge deductible. $6,000 a year is too much. Zoid, this sounds like maybe this is an Affordable Care Act question.
Yeah, so first of all, no argument on that. Deductibles have been increasing across many types of health insurance, but it's particularly difficult with the marketplace plans. But just in general, so you know why the deductibles are so high, it's because healthcare in this country is very expensive. And the thought process behind it is that if you set a high deductible, a consumer will be less likely, it would kind of deter them from getting care that's like expensive or maybe unnecessary. But what we all know and what the research shows is that people will also cut back on important and necessary healthcare services as well. One thing I want to mention is that for people with lower incomes, there are extra savings available on marketplace plans. It's the cost sharing reduction that I mentioned earlier that is on silver plans. That could actually bring your deductible down. So that's why it's very important to submit an application to make sure what you're eligible for. If you're just kind of shopping and you see high deductibles and that turns you away, you might actually be eligible for more savings than you realize. And again, submitting an application, it's not any sort of promise. So it's just a way to see what you can get. Also, every Affordable Care Act plan is required to cover certain preventive care services before you meet your deductible. So that's going to include common screenings for cancer and other health conditions, vaccinations, birth control, annual wellness exams. So even if you are stuck in a plan with a really high deductible, make sure to check what services are free before you meet that deductible. And then many plans will also have other things that you are still only paying a copay for, even if you haven't met your deductible yet. So for example, your primary care visits may still only be a $30 copay, regardless of how much you've paid into your deductible from the very beginning. So also look at that in the plan details. And then just in general, even though it's not ideal, having a high deductible insurance is better than having no insurance at all. There is some financial protection there because every plan on the marketplace has an out-of-pocket limit. So once you spend a certain amount, your insurance is required to cover the rest. So let's say you're hit with a $100,000 medical bill, but you have a plan with an $8,000 out-of-pocket limit. Unfortunately, you do have to pay $8,000, which is a lot for a lot of people. But if you are uninsured, it could be a much worse situation. So that's really important to consider as you're making these decisions. And then, that is a lot of information, but remember that you can reach out to folks to help you look at plans and figure out what's best for your situation. You can call us at Health Sherpa and speak to a consumer advocate. You can go to healthcare.gov. You can also work with an agent or broker or navigator in your area. And so don't let the fact that this is all really complicated and there's a lot of things to consider prevent you from getting covered.
Thanks. And Diane, did you have some thoughts to add?
Oh, I would just echo everything Zoid just said. I feel like the deductible is a way for the insurers to discriminate against people with costly healthcare needs, right? There's a premium that everybody pays, and then on top of that, a deductible that people with costly conditions have to pay. And that seems just entirely backwards. We want people to be able to get the care they need. And the argument, as Zoid said, is that it will somehow make people make smarter decisions about their health. But I think what we all know is that there are a lot of issues that arise where we don't know whether we are having a heart attack or we're having heartburn. And the last thing we want is for people not to go to the emergency room because of the cost of the deductible or the coinsurance. And so our current system is just hurting the people with the most serious health conditions. And also, it's discriminating against people based on ability to pay. It's rationing care based on ability to pay. So it is highly inequitable and it needs to be fixed. But it's the way that insurers keep the premiums down a little bit, as high as they already are.
Thanks. And next question is from Jerry Sutton, and they want to know, how much is the monthly premium for regular Medicare going up to? Diane?
So that regular premium, the standard premium for people with annual incomes, I think it's now under $91,000 a year, is $170 and I think it's 20 cents. For people with higher incomes, for people with incomes over $500,000, it goes up to $408.10 a month. So the premium is quite high. I want to add in here that part of the reason the premium is high is that this year it's gone up $20 because the government may be paying for a new drug to treat Alzheimer's. That's $56,000 a year. And so $10 of that premium is going towards the cost of covering that drug. And then in addition, the Medicare Advantage plans have been overpaid to the tune of hundreds of billions of dollars already and are projected to be overpaid in the next several years, several $100 billion more. And everybody with Medicare, whether they're in Medicare Advantage or in traditional Medicare, pays a higher premium as a result of these overpayments to the Medicare Advantage plans. Congress is well aware of these overpayments, but the Medicare Advantage plans threaten to campaign against members of Congress who speak out or who want to fix the problem. And they tell their enrollees that if their payments are cut, then people will, pay more for their Medicare Advantage plans. And so nothing is done about it. But everybody in traditional Medicare is subsidizing the cost of Medicare Advantage, and it's truly unfair.
Thanks. And you answered Arlene's question, which was why is the Medicare price going up? So our next question is from Kathy LaRoe. She's a previous breast cancer survivor, but believes it may have returned. What can you do if you make too much to qualify for DHS assistance, but can't afford marketplace insurance? She's one of the ones stuck in the middle in Michigan. Zoid?
Yeah, thank you for your question, Kathy. So this is a little bit complicated. So Michigan is a state that actually expanded Medicaid, meaning in theory, there is no Medicaid gap where someone makes too low for marketplace assistance, but too much for Medicaid in Michigan. There are some other reasons that someone might fall in that gap between Medicaid and marketplace. For example, if you are offered, what's considered affordable by the test that the IRS uses, insurance through your job, but it's not very good insurance. There's a very high deductible, for example. You're not eligible for a marketplace subsidy, but your income would be too high for Medicaid. I don't know if that's the case here. That is one example. It is possible that you might need to speak one-on-one with someone who can kind of help you navigate your financial situation, Medicaid, and the Affordable Care Act plans, whether that be a navigator, an agent, or one of our consumer advocates at Health Sherpa. We can help you with checking your eligibility just to make sure you're making an informed decision, sure what you're eligible for. If you've applied for Medicaid and they've denied you, then that's your denial, but we can double check and see if you're eligible for anything through the marketplace. Outside of that, there's a foundation I recommend checking out called the Patient Advocate Foundation. They have case management services, so they can also help you with kind of checking what sort of programs you're eligible for. And then even beyond that, as you get care, help you with managing that and the program or insurance that you're in. And they do have a specific case management line for breast cancer called the Donna Care Line. So if you go to patientadvocate.org and then check out their case management services, there will be a number for that. We're not affiliated with them, so I don't know exactly what their process is, but that is an organization that I've directed folks to if they have some sort of chronic illness or life-threatening illness and they're having trouble getting care.
Thanks. And also, Kathy, if you need a mammogram, you might want to go to your local Planned Parenthood that operates on a sliding scale. So it should be affordable or maybe even free, depending on your income level.
One other idea is for the preventive care services and primary care services, there are thousands of federally qualified health centers around the country, and they provide free or low-cost services to folks. So you might check them out as another option. And I guess what we can do is put up on the Care Talk website other free resources that you might look to for help. We'll do that.
Thanks. And our next question is from Margie Brewer. She wants to know, why is it that we can't get a decent dental and vision plan for Medicare? When you cut your meals to one a day so you can afford a dentist bill, there's no extra cushion. You stop your meds and cut food to get glasses. Diane?
It's a travesty. It's just incomprehensible why we can't get these benefits. But a lot of it has to do with the Dental Trade Association and the Vision Trade Association, I believe, which are opposed to any rate regulation for their services. I know this is the case also with the Audiology Trade Association. They just do not want the government regulating what they do. And so they make it really, really hard for the government to provide coverage and really expensive for their services. I know in the case of hearing that Senator Sanders was expecting to cap the amount that the government paid for hearing aids, much like the Veterans Administration already does. They pay, I believe it's $500 for what would otherwise be a $3,000 hearing aid. And there's no reason that Medicare, which represents 63,000 Americans, shouldn't have that same leverage and pay $500 for a hearing aid that would otherwise be $3,000. But for whatever reason, other members of Congress, and I believe the White House, feel very strongly that we should pay the market value that market price that people pay in the individual market. That's what the government should pay for hearing aids. So that drives up the costs, and as a result makes hearing aids basically unaffordable for the government to cover. Or if they do cover hearing aids, what we're probably going to see is high out-of-pocket costs for people, meaning that people with lower incomes might struggle to afford those hearing aids. It's really unfortunate. There are a number of places you can go for free and low-cost dental, vision, and hearing care. We will put up on the website some of those places so that you can see if maybe you can't get your services through those routes.
Thanks, Diane. And Alejandra Riso lives in West Palm Beach, Florida. She doesn't have health insurance and doesn't work because she takes care of her mom. She needs to do a mammogram, but doesn't know where to go that they will do a free or low-cost mammogram. So I mentioned before that Planned Parenthood offers a sliding scale. And Diane mentioned community health centers, federally qualified community health centers. Diane or Zoid, do you have any other suggestions?
Those were what I would suggest as well. I did specifically look in West Palm Beach, and it looks like there is the Community Health Center of West Palm Beach, and then there is a Planned Parenthood called West Palm Beach Health Center. So either of those should be able to assist you with free or sliding scale healthcare, including mammograms.
And also, Alejandra lives in Florida and doesn't have an income because of caregiving. So that just means that brings to mind how important it is that the Build Back Better bill passes, because Florida is one of the 12 states that did not expand Medicaid. So that means that she can't get health care because right now because she doesn't have an income, she's not eligible for ACA plans, but she can't afford an ACA plan without help. So one of the pieces of Build Back Better will fill the Medicaid gap so that people like Alejandra will be able to get health care through the ACA, a $0 plan through 2025. Other pieces, as Diane was talking about, it would strengthen Medicare to include a hearing benefit. It was talked about expanding to include vision and dental, but those so far have been left out of the bill. But what you should be doing right now is contacting your senators and telling them to vote for Build Back Better and to also hold the line and make sure all of the healthcare pieces that are in the bill right now stay there, because ACA plans are more affordable than ever thanks to the American Rescue Plan, which passed earlier this year. But those subsidies end next year. So part of Build Back Better would extend those subsidies through 2025. So it would keep making ACA plans more affordable, as well as filling the Medicaid gap, lowering the cost of prescription drugs, strengthening Medicare, including funding for home and community-based services, so that people who need caregivers can get care at home instead of being forced to move to an institution if they don't want to, and including paid family and medical leave if you need leave to care for yourself or for a loved one. So all those pieces are critical. All of those pieces are in the bill that passed the House just a few days ago, but the Senate is going to do their own bill. And conservative members of the Senate may be tempted to cut some of these things because they may think that they're not as important as other pieces. And so that's why it is so critical that you call your senators. Don't just email, call them and tell them how important this is going to be to you and your family. And keep it up, keep going, because if we are too quiet, we could see these things cut back even further.
Yeah, going along that point, I know it often might feel like calling your representative isn't going to do much. You're likely not going to be able to speak with them directly. You're going to be speaking with someone at their office. But I promise there is someone there whose job it is to answer the phones and write tally marks of who called for what and how they wanted you to vote and what their concerns were. And that adds up. So even if you can't actually get your senator on the phone, which you likely won't, it is still important to make your voice heard, whatever issues are your concern.
Absolutely. And if they're having a town hall or other event in your area, make sure to talk to them in person. And thank you for joining us for Care Talk. If we didn't have a chance to answer your question today, you can call and text it in, and we will keep answering your questions for the next few weeks. So thank you, and make sure to call your senators about Build Back Better. Thanks.